Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. Beginning in 2008, the first day of fall was designated as Falls Prevention Awareness Day. This year, it was expanded to Falls Prevention Awareness Week. With me today to discuss falls prevention is Wynton Geary, Health and Wellness Manager at Senior Connection Center, and Christine Hamacher, Executive Director at Sages Theater. Thank you for joining me today.
Thank you for having us.
Thanks for having us.
According to the National Council on Aging, 1 in 4 Americans age 65 and older falls every year. Now, falls are not a normal part of aging, but they are the leading cause of fatal and non-fatal injury for older Americans. Wynton, what are some of the things that cause falls?
Well, it's a good question, Patricia. There are many different things that can cause a fall. It can be medication related. There could be a physical disability, or just inner ear issue. Any kind of thing can cause a fall.
Okay. Well, what are some of the things that individuals can do to help prevent falls?
Another good question. So they can. We have these things called like a few steps that people can take to prevent falls. First thing they can do is find a good balance or exercise program. There are plenty of those in the community. Something that seeks to build balance, strength, flexibility. You can also talk to the healthcare provider, their doctor. Maybe if they're seeing a physical therapist for it, talk to them about it to get an assessment for their falls risk, and not be afraid to share their history. I know a lot of people are afraid to talk to healthcare providers or even their family. They can also talk about medications, any medications they're on, because if we've ever read the medication bottle or like the description of them, you see some side effects, and one of them is typically, it could put you at risk for fall, cause dizziness, nausea. Some of these things go into effect when talking about falls. It can also be a visual problem. They can get their eyes checked, get their hearing checked, make sure they attend those appointments annually, as well as reduce falls risk in their homes. I know a lot of us, if you're a pack rat, as my family likes to call it, you have a lot of things in your house, and many of those can be falls risk, tripping hazards, the lack of lighting or appropriate lighting, making sure the stairs are safe. If they need to, they can install grab bars. And, this is really important as well. You want to talk to your family members as well, as far as what's going on with you and how they can help support you in reducing those falls.
Friends and family members can be great advocates and allies in helping to reduce falls. Now,
Yes,
Christine, you have been the director of Sages for a while, and Sages is Senior Actors Guild and Education Services, correct?
Yes, yes.
And Sages does Plays with Purpose?
Yes, ma'am.
What does that mean? What are Plays with Purpose?
Sages started a couple of years ago with a young lady in her early 70s wanting to write plays for seniors, about seniors, really highlighting the changes that they go through and the positive ways that they can approach those changes. And so when I ran into her, I asked her if she would write a play about fall prevention. And she wasn't quite sure how she was going to do that and make that a comedy and drama at the same time, but she did. And so that's where Plays with Purpose was born. We decided to become a nonprofit last year, and our Plays with Purpose are one-act original plays written by Linda Goldman and collaborated on with people in the community and our board members and our Sages members, all of them, to entertain, educate, and empower seniors on topics of positive aging, ways that they can adjust to the changes that come into their life, and share and discuss those issues more freely.
And that's important to empower seniors, because many of the things that you were mentioning, and Wynton, many of the things you mentioned, are things that seniors can do for themselves and take control of their environment and their situation.
Absolutely. 70% of falls, it's shown in studies, can be prevented. And that's where this came out of. I do want to say, you know, we're 1 in 4 older Americans falling now. A couple of years ago, it was 1 in 3. So we're making progress, and we have to keep making that progress. And part of it is raising awareness and getting people excited about being advocates rather than hiding from it. Fear is the #1 reason people fall. It's a 4-letter word we don't like to use.
Well, let's watch a short clip of Denying Gravity and see what SAGES does.
They check you for a concussion?
No, I had my head examined all right. No concussion. The result was just lots of lectures on stepping out into the dark.
Not your smartest decision. Imagine what would have happened if it hadn't been the season and your neighbors hadn't been there. Oh, man. You need a medical alert button when things like this happen so you can call for help, like mine, see?
Oh, I can't wear that. It's not my style. There's no need making a big fuss yelling, "I've fallen and I can't get up!"
Christine, that sounds like an entertaining way to learn about fall prevention.
Absolutely. It really opens the door for discussion. The audience members, and we've had 300 to 500 at our live shows in the last couple of years, they really open up. They relate to the characters on stage. They hear comments that they've heard before from others or out of their own mouths. And it just makes it more comfortable for them to talk about the ways that they can keep themselves safer with their loved ones and, you know, with the folks that are next to them. It creates a community, you know, where everybody is focused on the same thing, but benefiting from it at the same time, and there's not a stigma attached to it. We want to remove the fear. Fear is a 4-letter word. It's the #1 reason falls occur. And the story in this play shows all the different choices that Claire makes since ending up in the hospital with a broken arm, and how that impacts her loved ones, her life, her independence. She enters a danger zone of sorts, and the audience can see that that independent streak in her, that little feistiness, is great, but it needs to be channeled in the right direction. And so we see how things can go from bad to worse, but then also how she redeems herself. So we like to keep it lighthearted with the comedy that people can relate to, but have the drama in there so they really do see the seriousness of this issue and make some decisions to do things differently, and not succumb to a fall, not allow gravity to take over.
So some older adults may be in denial about the risk for falls. Would this be a good way for a child or a friend or a relative, family member to start that discussion?
Absolutely. We've had so many people either bring them to live shows or show them the video, and they don't know why they're watching it at first. They think it's just for fun, and then they realize a message is being given, and they start to pay attention. And, you know, they might tongue-in-cheek be giving their loved one a hard time about it, but it really is meant to open up the discussion. So the way that theater works is it stays in your mind even more than music does. And so it really gets people to start thinking about their own scenarios and their own lives. And we recommend that you watch this with someone. Watch it with a loved one. The link will be available all week through our website, and you can call a relative in another state and get on the phone and watch it together. You know, it's an hour, but it's a good hour where you can laugh and cry and relate to one another and make some decisions that are going to improve safety.
That sounds like a great idea. Now, how does someone find out about in-person or virtual presentations that are happening now?
Well, we have a website that they can go to, www.sages, S-A-G-E-S, theater, theater.org. And the video is kind of hidden. You have to have the link to get on there. So we're going to put that on your slide at the end of this interview. But it is the website /watch-denying-gravity. That will be available all week. And we also have kits and DVDs available for communities to show to their residents or to share among friends and family. So just give us a call if you're interested in that, and you can reach me on my cell, 727-692-0902.
And we'll have that phone number for you as well. Wynton, you mentioned programs and classes that are available in the community to help people learn to prevent falls. What are some classes that are available at Senior Connection Center?
Oh, I'm glad you asked. So here at Senior Connection Center in the Health and Wellness Department, we offer a number of evidence-based programs. One of the ones that truly relate to falls prevention, the number one that comes to mind right now is the Tai Chi program that we offer. And this program is the Tai Chi for arthritis for falls prevention. It's really a low-level, low impact style of Tai Chi. I know many people, when you think Tai Chi, you're already thinking low impact, but this is like the lowest of the low impact. We like to call it beginners, but it really helps when it comes to strengthening those smaller muscle groups, those, supporting those joints, ligaments, tendons, everything that we kind of overlook in daily life. I like to explain to my classes how in everyday life, once you learn how to walk, you're just going. You don't even think about walking, you just walk, right? So we like to break it down and show you every step that it takes to walk and how your body shifts and what different muscle groups that that are used to support walking, right? So, once they see that the program kind of clicks and they understand how it is a benefit, another program that we have that we can't really offer right now, and it does sadden me a little bit, is the Matter of Balance program. Due to the pandemic, we're not able to offer it in person, and with it being evidence-based, we're not able to, alter the program in any way. It'll mess with the fidelity of the program. However, Maine Health, the organization that houses the program, develops it and keeps it updated. They're actually doing a pilot right now for virtual programming. So we're hoping that the rollout for that, is going to be coming soon, hopefully 2021. We can get people back in classes because it is truly one of our more popular classes that we have here. So that's something to look forward to. The pilot's going well, from last I heard. So we're hoping to get it going soon. But other programs that we offer the diabetes self-management program, the chronic disease self-management program. We have an active living program as well as a healthy eating everyday program. Now you say, what does it have to do with falls prevention, right? These different programs, if you become a better self-manager, you're, taking more control of your own life, maintaining that independence, learning how to do it a little better, so that you don't have to fear that someone's going to make you dependent upon them and pull that independence away from you. So these type of programs, when you take better care of your health, it has an indirect effect on balance, on falls prevention, to keep you upright, keep you healthy and independent.
Not to mention, it's a great example, Wynton, for our senior community, they are wonderful fountains of wisdom for us and experience. And it's a great example for them to set for our generation and younger to make sure that you're taking care of your health throughout your entire life.
Oh, definitely. Yes. I truly believe that. That's a good point to make.
And as you mentioned, so many falls are preventable, and taking control of health is empowering seniors to take control of their ability to prevent falls.
Oh, yes.
Studies show 70%, up to 70% are preventable. And that's why we want to get the education out in any format that we can, because, a fall can end a life and we want to save lives.
Absolutely. Wynton, how can people find out about those classes?
Yeah, so there are a few different ways you can find out about the programming that's going on at Senior Connection Center. You can always check the website. That's seniorconnectioncenter.org. We want to make sure we put that in correctly. We want to make sure you go to the correct website. You might run into something you're not really looking for, or maybe you are. But you can check out the health and wellness page there. We keep the page updated, as much as possible with ongoing classes. If you want to get a jump start on things, you can just give me a call directly. My direct line is 813-676-5566. That comes right to me. I'll talk to you about any program that we have in the works, put you on an interest list. And once that class is, once it's scheduled, let you know it's scheduled or what day and time it'll be. And if you're still interested, we can put you in there. You can also check the Facebook page. Senior Connection Center also has a Facebook page. Trying to be really active in social media. So if you are the type of person that's really active on social media, that's a good route to go as well. Check out the social media. It's tons of other good things on that Facebook page as well, not just health and wellness, but in many different items and topics that will be beneficial for older adults.
Great. Thank you both for being here today and providing such important information on fall prevention.
It's our pleasure. Thank you for hosting this segment for sure, Patricia.
It should be really beneficial to the community. I want to see when it's out there and the impact that it has.
Christine, do you have a final thought for us?
I think, we have to remember that we can make a difference, and we can do it one by one, and it does spread by word of mouth. And we're all doing our best with social media and these virtual platforms during COVID. But even more impactful is telling someone yourself, sending a message, making a phone call, and letting them know that these resources are available, watching them with them online, having a discussion, and then making changes.
Wynton, final thought from you?
Oh yeah, sure. So the word that comes to mind is assertive. To be more assertive as older adults, as people in general. Kind of be a bit more of an advocate for your own needs. Like, what's going on with your body better than anyone else. Take better control, be a part of your healthcare team, and just, talk it out and express your needs. You'd be surprised how many people are willing to listen and accept that information from you.
Lots of great information today about fall prevention. We hope you will watch and take control of your own health and your own ability to prevent falls. I'm Patricia Henderson, and this is your Weekly Connection.